you once again for joining us here on Michael Anthony Cuff Live. Today on our show, we're going to be looking at sex therapy. Over time, we have had Dr. Karen Carpenter, sexologist, with us, and we've been looking at different aspects of what she does. Today, we want to take you inside, literally take you inside her office and talk about some of the myths, some of the misunderstandings around what she does, the reason why she does what she does and how she does it. And so this is the journey that we're going to be taking today. And as usual, we say thank you very much again for joining us, Doc.
Thank you for having me.
Well, first of all, let me make a couple of disclaimers. And this is one, it's very rare that an interview should be done inside your office because usually it's reserved for clients.
For clients, yeah.
Okay. So thank you for that privilege, but it just fits into the theme of what we're doing. Secondly, it's also not usual that you're sitting beside the client.
It's never. I never sit beside a client. It doesn't happen in therapy.
And that's because?
To be an effective therapist, you have to be objective. You have to maintain what we consider a professional, empathetic distance. So although you maintain a distance, you do try to understand what the client is going through, what they're feeling, what their emotions around a particular occurrence is. But you need that distance in order to be able to assist them. The reason they come to you is because you have that distance. They could go to a family member, which one, you have the professional training, and two, you have the distance that allows you to help them through the process. So somebody has to stay in control of the process.
And I'm also surprised that I don't see a couch. You know, usually there is
the idea
that there's always a couch and the client is always lying on the couch.
No, we have a tiny couch, which is very diminutive.
A very
tiny couch, but also I like to keep the environment fairly sparse. I like to have as few distractions in the environment as possible because I'm really engrossed in what the client is saying. I really want to focus my attention on what the client is saying. And equally, I'm not trying to provide entertainment for the client. I'm trying to give them a space in which they can say what they need to say without feeling that there's something else competing.
Is there any instance in which a therapist, a sex therapist, would use a couch?
As in have the client lie on the couch?
Yes.
I don't know of any instance, certainly not in my own training, and where I trained, hundreds of us have been trained by the same team in the United States, in China, in New York, India, and we're being trained by the same team, and we've never been told of any instance where that weren't necessary, not to my knowledge.
Certainly not what a sex therapist does.
Not usually, because we really want to have eye-to-eye contact with the client. We really do want to engage with the client's story and to be able to understand what they're going through.
Okay. Well, let's get to the fundamental question. What does a sex therapist do?
Okay, sex therapists essentially assist persons with sexual dysfunctions to improve their sexual performance. And there are a number of sexual dysfunctions that are listed in what we call the DSM-4, soon to be a DSM-5, which is a diagnostic statistical manual, and it's used for psychiatric and psychological illnesses.
That's like the Bible of the profession.
Yes, it's the list of all the known illnesses of the mind. And since most of what we do in sex therapy is based in the mind, even though sex is in the body, it actually occurs in the mind. So if we can help the mind to understand what's going on, we can improve how the body functions.
Is sex therapy and sex counseling the same thing?
Well, I'm not sure there is a term called sex counseling.
Or what a counselor does versus what a sex therapist does?
My understanding of what a counselor does is that a counselor provides an opportunity for you to talk about your issues and will provide guidelines for you, will help you to problem solve, give advice at times. A therapist is assisting you to help yourself.